MCC, it's like basically, oh, well, she's,
Our staff has also done the training. It's
yeah, that's where we met Joe.
Oh,
Very
cool.
good. Yeah. He was
Hey.
in our class.
I was there too.
Oh, you
Hey.
I didn't see you.
In September?
Was it September?
No, it was like April.
Oh. Maybe he went back and did another one.
Maybe. Because he brought samples.
Oh, you know what? We didn't meet Joe at the CCC. We met him at the Trichome Institute. He drove to Pennsylvania that day.
Oh, is that it?
Yep.
There you go.
Yep, I was like, yeah,
Okay.
sorry
I
about
was like,
that.
I was there.
Okay.
Wink, wink. Are we
Small
there?
world.
Yeah.
So when it comes to the coaching part of this, I work directly with patients to help them find their goals, get beyond the diagnosis. A lot of the times I'm doing cannabis coaching to kind of delve a little bit deeper into what will work for you, helping you find the right strain, the right administration. It tends to lead into life coaching so that you're making better choices to reach your potential. So that's what coaching is all about.
Are you taking new patients?
Always.
Oh.
Yes, absolutely. So this is our office here. The coaching area and consultation, we often do talks at our office, as well as obviously here and other places around Columbus. We also do talks in Northeast, Central, Southern Ohio, so we move around quite a bit. And so starting with pain, no one should suffer. So this is a statement that we definitely heard going into the 90s, 2000s, going into medical school and residency, that all pain was going to be treated, even the slightest amount. And at that time, the option that was pushed heavily were narcotics, right? Opioids. And so literally every pain, no matter how small, whatever was happening, was always treated, and that was the go-to. And of course, fast forwarding, here we are in a situation where there's an opioid epidemic, that the worst part of this is not only the lives that have been destroyed from it, but then when people have decided to not use opioids, or when physicians, out of fear at this point, have cut people off from the opioids, they have not given them a good alternative.
Right.
And so, which kind of, long story short, led me through this path here.
I can attest to that. I went from 120 Percocet 10s in a month to about 10 or 15 with the use of medical marijuana.
Very good, yeah. And then, so it should really be encouraged and supported, more than anything
Right.
supported, so, yeah. So let's talk a little bit just about acute pain. So we all know this, you stub your toe, you fall down, you hurt yourself, you have a sensation from the injury, and to make a long pathway very short, that sensation, that signal is going to go into your spinal cord, up to the brain where it's processed, information is then transferred into what do we do now, and then it comes back down through the brain to your finger where a motor response is produced, moving your finger, whatever it may be, and this is typically what happens. So in an acute pain situation, we know what happened. Even with worse pains, they might last, if you break your leg, it might be 3 to 6 months there. And there's of course the anxiety of that moment that occurs. But it tends to respond well to medications. It's a short term, we understand the pathway, it interrupts that pathway, so it kind of numbs it down, and we tend to do well. We've all heard of rice, where you're resting it, ice, compression, elevating it, and over time things get better. And when the body heals, the pain ceases. So this is your typical pathway, which typically if you use opioids in this case alone, tends to do well. However, chronic pain is much different from this. So in chronic pain, it's gonna last longer than 6 months. Sometimes we don't even quite know where the pain's coming from. It could have started from an injury, or sometimes life is going by and you start developing more and more pain. Even after the injury is over with, those pain signals keep going. And so this is part of the problem. And many times it will come out of nowhere. And I've heard many stories where they think there was something that happened, but they can't pinpoint what brought about the chronic pain. And that really means that that pain pathway has been activated and it's not turning off. Things that often create chronic pain are headaches, arthritis, cancer, neurological pain, back pain, fibromyalgia, inflammatory and irritable bowel syndromes, TMJ, interstitial cystitis, which is now called irritable bladder, pelvic pain, and of course there are other ones. But these are very common pains that, yeah. And when you're looking at the 21 conditions that qualify people for a card, it just says pain. But these are many of the things that people are looking at, that they don't realize that they're on that list. But when you've been dealing with a pain for greater than 6 months or more, that would qualify you, and these are many of the ones that people come to our office with.
What about like endometriosis?
So it in itself is not listed, but with chronic pain it would be considered, yes. So it kind of fits under that pelvic.
Yeah, something not right.
Yeah.
So when acute pain goes into chronic pain, so the anxiety that you initially had at the time of that injury, now it's going on for several months, and that anxiety is now turning into more of a depression. Using the narcotics or pain medications that you were given initially, which seemed like a good idea, now it's leading to more misuse simply because it's just not, you're not responding anymore to the medication itself. And instead of rice, your best options are movement, exercise, some sort of pain treatment, and therapy, or some other form of treatment, which we'll get into. But many times we go back to rice, where when you're dealing with chronic pain, you really should be, instead of focusing on the rest, you should really be focusing on the movement, okay? So the blue line up there really suggests your acute pain. You have an injury, go through the pathway, and now you have pain. And the lower part here has to do more with chronic pain. Again, you have the injury and you have the pain, but eventually that continues. And with that, as it continues, you start developing anxiety and stress. You start to anticipate the pain even when it hasn't happened. You hurt yourself on the stove in the kitchen. Over time, walking into the kitchen produces, you don't even realize this sensation that then produces some of the pain. And as that goes on, the anxiety and stress that you have actually becomes a stronger signal of pain than the actual injury. Chronic pain creates its own pathway that without proper treatment, it's very difficult to resolve. So if you're still trying to treat your chronic pain the way you do acute pain, it's not going to work as well.
What's learned behavior? Or did they just misspelled learned?
I don't even see it.
On the far left?
Oh, it's misspelled. Yeah,
Sorry.
thank you.
I didn't know whether, it was like,
No, it becomes a vicious cycle.
okay.
So with the chronic pain syndrome, this is where all of those sensations grow even deeper. 1/4 of people with chronic pain are going to develop more of a chronic pain syndrome. So that feeling of depression, anxiety, sleep, it's really taking over your life. And this graph or picture here shows that you start with the tissue damage, and then you have the pain sensation. Then you have thoughts about the pain. So meaning you can have muscle achiness, discomfort from exercising, and this is good pain, and you're happy and proud of the fact that you can't make it down the steps because you did too many squats. That you consider it in your brain a good pain. But then that same sensation, and it's related to an unknown reason, fibromyalgia, and it's a bad pain. And so what you think about the pain becomes very important. And of course what you think about it then leads to emotions, which then might be something positive, you're motivated to go and work out again, or something negative where you don't even want to get out of bed because of the way you feel. Then there's the whole concept of suffering, that for some people how they interpret pain in general is how they've been groomed to think of what is it. Do you suffer through it? Do you kind of push through it? Do you kind of walk? It's the way you've been groomed to think of pain. And then the pain behaviors, what do you do? Do you take more medications? Do you try to fight through it? Do you exercise? Are you going to the doctor? What do you do about pain? and then what's going on in the outside world. So an example is my daughter bumped her arm in the kitchen counter yesterday, I think. And boy, she was withering. She was on the floor. She was crying. We're getting ice, we're putting CBD, we're just lathering her, we're doing all of this stuff, and she's still just withering in pain. I guarantee you, if she did that at school, she would have gotten up and walked away. It's the environment that she was in allowed her to perceive her pain in a different way.
I never thought about it like that.
So chronic pain, more than 30% of Americans are living with some form of chronic or severe pain. It is one of the most common diagnoses, the most common diagnosis in the United States, and the most common diagnosis that we see for medical cannabis as well. So how do you treat chronic pain? So I think most of us have seen this at some point or another, that you start with your NSAIDs, which are supposed to decrease inflammation, possibly Tylenol. Many times in acute pain, you don't necessarily want the NSAID because that inflammatory process is actually part of the healing, but we are, just as we were very quick.
I'm so sorry. I'll turn it off.
Just the way we're very quick to use opioids in the past, we are just layering people with more and more anti-inflammatories now. But many times in acute pain, your body's protecting you and helping you heal.
Right.
So another option is Tylenol, which it doesn't have that same anti-inflammatory effect, but it will decrease that sensation of pain. And so that's definitely an option that I think we've pulled away from in medicine a little bit too much. Obviously, you don't want to overdo either one of those just because of liver damage and what have you. So the pain's continuing. Now you're trying different antidepressants, Elavil, Cymbalta, Paxil, to change how your brain is processing the pain. Eventually, I think it seems like everyone and their mother's on gabapentin right now. And the anti-seizure medication that decreases that neuropathic pain that you might experience as the chronic pain continues. And of course, there's steroids that we do bursts of or tapers of, and of course opioids, which we've leads to tolerance and dependence and addiction. So in 2016, approximately 116 people died every day from opioid-related drug overdoses. And mainly, the reason that this is a problem with opioids and not a problem with cannabis is that it connects to a part of the brain that ends up decreasing your ability to breathe. And so there are no receptors in
Brainstem.
brainstem, I just can't think of the word. Okay, there's no receptors in the brainstem for cannabis, where those receptors are in the brainstem for opioids, which you take too many and eventually you stop breathing. So that's why you never can have an overdose to the point of death with cannabis.
So we say here that CBD and cannabis in general
Sure.
is really safe because there are not cannabinoid receptors in the brainstem. So
Right.
no matter how much you take,
You can have a
you're
bad
not
day.
gonna stop breathing.
You can have a bad day, even with CBD, you're not gonna have a bad day. You have THC in, you might have a bad day, but you will not die. You might think you will, but you won't. And so, 1.5 million people misuse prescription opioids every year. So whether you're taking from your mom's stash or overusing or buying it over the internet or simply overloading and using them not for the purpose that they were originally prescribed, this is happening. So I don't want to ignore this because I think this is where we often kind of fall short, and how you treat pain through different types of therapy should not be forgotten. So whatever you choose to do for pain, it's really important that you don't leave this out. So people kind of underestimate the power of physical therapy. I feel that I have patients that do incredibly well with it after I have bribed them to go, but either they've had a bad experience in the past or they just feel like, why am I doing these exercises? But those exercises strengthen the body part that might be weaker, allows you to balance your body so you're not likely to have the same injury that you had in the past, and so it should not be ignored. Physical therapy can be very powerful as far as regaining your strength and not having the same injury again. Other forms that people should investigate, obviously Tai Chi or yoga will obviously give you a calming but also strengthening very much as well. Art and music therapy, as I talked about that other pathway that chronic pain creates, you're going to want something to decrease that stress and anxiety that can develop. Pet therapy, they find that seniors do incredibly well having a pet in their life to decrease their anxiety, their stress, and also helps with their pain. And of course, massage to relax those muscles, bringing the blood supply back into the area, and meditation again to decrease that anxiety and stress. Some people find that they've gotten to a point where cognitive behavioral therapy is needed. And so at this point, you're really trying to interrupt that stress anxiety pathway. Find out why you've gone down this path and try to interrupt it. And many times that's done in group sessions as well as individual. And there's also chronic pain coaching, which I do some meditation work in my coaching practice, but it's really about being goal-oriented, getting beyond the diagnosis that you've been given to kind of recognize who you are again, and to have growth and increase your focus. So other tools for healing. Obviously we're going to talk about cannabis here. Acupuncture is something that a lot of people use and has millennial years and years of research behind it that people will turn to that. Cold treatments to decrease the sensation of the area, as well as making it a little bit more comfortable for you in the moment. A lot of people will use cherry extracts, as well as ginger, vitamin D to help with pain. Obviously, if there's surgery that needs to be done, let's not ignore kind of the obvious in that sense as well.
What's the cherry? What does that do?
I believe the cherry extract, I'm trying to remember. I don't know if you remember.
I don't remember. I think the cherry more along the lines of deals with the not the flavonoids, but the terpenes.
Oh, the terpenes.
Oh, okay.
Yeah.
Yeah.
Okay.
Okay, so where does cannabis fit in? So there's tons of research. People will often say, why do you want to do that? There's nothing behind it. This is just a small sample of things that I've been looking at, but there's a lot of research out there. A lot of great research comes out of Israel, where they have a lot more freedom to do research, but there are clinical trials, there are research trials that are going on, because as we get further and further into this, people want to know, they want to have the correct scientific data to back it up. So I want to look at a couple of studies, one looking at THC for evidence. So there was a study with Dr. Abrams that took actually around 200 patients initially, but as they whittled down to who could fit the criteria and who could sustain the research, they ended up taking 50 HIV patients that had neuropathic pain. They divided the group into a placebo group as well as ones that were taking 3.56% THC into, so this was smoking cannabis specifically. They had these patients actually removed any other forms of cannabis, pain medications, what have you, prior to going into the hospital, and for 5 days they ended up smoking cannabis or placebo for 3 times a day for 5 days. They then did a review of what their pain, how they perceived their pain. They also did an experimental test where they put them into pain situations and to see how they perceive their pain with that. So what they found, and that's the lower, should I use this? The lower line here, is that the participants that were actually using the THC had a significant decrease in their pain compared to a placebo. Now when it comes to pain medication and what's considered significant, any perception of pain that they see greater than 30% is considered an effective dose. So they found that 13 of the 25 participants that had used cannabis had a 30% reduction in their average daily pain. Of course, the placebo, there's always gonna be somebody, right?
Mm-hmm.
And so, 6 out of the 25 participants that had the placebo found a 30% reduction in their average daily pain. This is the same level of pain reduction that they find with gabapentin as well as some opioids.
Is this the same Dr. Abrams out of Israel?
No, he's not from Israel.
Okay, because there was a doctor out of Israel, and they spent like $3 billion doing a marijuana research.
Uh-huh.
I just started looking into that. I was just
No,
curious.
no, it's not the same one.
Okay, perfect. Thank you.
So their conclusion is that the smoked cannabis was very well tolerated, effectively relieved the chronic neuropathic pain that the patients were experiencing, and the findings were comparable to other oral drugs for chronic neuropathic pain and without side effects. So CBD evidence. So I ended up choosing a study that looked at topicals because some people are very open to them, some people aren't. I think topicals are amazing if you're able to use them. So in this study, it was an animal study out of European Pain Journal, and they used a topical gel CBD for rats that had arthritis. And they used this every day for 4 days, and they had 4 different doses that they were using. They ended up measuring the size of their palms, the gait that they had after using it, and there was a significant drop in inflammation and signs of pain, of course without side effects, by using the topical gel CBD. They found the most effective doses to be the 2 higher doses that they were using. So, which is better, CBD, THC? So I have a lot of people that ask this, and I think the most important thing is knowing a little bit more about what each of them do, so then you can decide how you want to use them apart or use them together. So this is the wheel of cannabinoids, right? So you can see here this is CBD as well as other cannabinoids that you would find in a full spectrum CBD, as well as THC that obviously you can only obtain at the dispensary, okay? And so CBD is very good, as well as the other cannabinoids, and not just pain reduction, anxiety reduction, and inflammation, where THC relieves pain because it actually decreases your awareness of it. It actually allows you to not be as annoyed by it, to not have it be so much in the forefront of your mind, where the CBD actually is more effective when it comes to actual inflammation as well as relieving the pain. So what would you choose? So if you're looking at a CBD, because it decreases that inflammation, decreases the pain, and it's something that's great for daytime use, it doesn't give you that euphoric effect, then CBD is great. THC, it does give you a little bit more of a high that you might experience. It's better for nighttime use, but it does decrease that perception of pain, and is also very effective. So ideally, if you are able to go to the dispensary, something that might be 1-to-1, where you're getting a nice blend of both, is a great option. If you're not going to the dispensary, a full spectrum CBD is great because you're getting all those other cannabinoids plus the CBD. Keep in mind, when you have full spectrum, you might have a little bit more of sleepiness that might occur. You might feel a little sedated depending on your dosage. So keep that in mind. You can use just CBD by itself as an isolate, which is also great, but the more pain you have, probably the more medicine you want. So what can you expect? When using cannabis, using CBD for your pain, you will no longer be as preoccupied. So we do follow-ups on our patients every 3 months. Some of them still are using their CBD, hemp-based CBD. Some of them are using only cannabis. Some of them use a combination. And they say, well, it's not totally gone, but it doesn't bother me as much. And that's really kind of going back to that one graph, how you perceive and feel and think about the pain is sometimes more important than the pain of where it started, okay? Decreasing inflammation is very important with CBD, so obviously that's key, and so many of our patients are able to say that they've either decreased or eliminate the use of their opioids, which is, it's incredible to do the follow-ups and to hear what people are doing.
Yeah. Anyway.
Yeah.
So, dispensaries are now open, kind of, right? Kind of, right? So-
One.
Inexpensive.
Inexpensive, yes. So, some cannabis strains for chronic pain. So I kind of separated them out here. Starting at the top, ACDC is going to be a CBD hemp-based or cannabis. I'm sorry.
Still cannabis.
CBD by itself, it has 1% THC in it. So I usually tell my patients to start there because that's going to be a bulk of what's going to be helpful for you. And then going into the next two down, the green ones, which are going to be a 1-to-1. So they're going to be, the THC to CBD are almost equal, with the Harlequin almost equal as well. And so this is also a great option because the CBD and THC are competing around the same receptor. You won't get that high, you get a little bit more of a mellow feeling, but still able to use it during daytime.
Can I ask, how did I don't know if it's just you or if all the doctors have this, like what this card is showing. Do you guys go through training to know what these strains are, or how did you compile your list of what to start with or try?
Well, I can't say that I got this from the physician training. I did additional training to be able to identify and know more about the strains themselves. In this case, this list comprises things that are actually in dispensaries near you.
Okay.
So I could give you a long list of things that are not even in the state, but that doesn't do you any good, right? So I first try to find out what is actually in the area, and then kind of doing some research based on the education that I've already received and kind of compile a list that I think would be helpful.
Perfect. That's good. Thank you.
But yeah, the CTR training doesn't get into strains particularly. And then the lower half here are the more higher THC options. So anywhere between 13, we have 20% THC as well, with lower end of CBD. This will help you sleep. It also helps with the pain. And so, so it's a great option. Also, kind of we were talking a little bit before about if you happen to have a bad day and kind of went a little bit over the edge with the THC, CBD will actually compete for that receptor area for the THC and will kind of mellow you out a little bit faster. So if you do take in too much THC, we want you to drink water, some fat and some fiber to kind of soak it up there. Hopefully you have a good friend with you. Try to go to sleep. But if you do have CBD, that's a great thing to take in. And it's usually a higher content of CBD to be effective, but taking in that CBD will kind of get you back to where you want to be a little bit sooner than later. You could also use other phytocannabinoids like black peppercorns and chew them. I don't know if that would be my choice, but in a desperate situation, now you know. Or if you don't like your friends, then you could say, you gotta chew these peppercorns. So, yeah, what have you, right? So that's, I believe that's just a picture of shark right there.
Shark.
So if you're looking at, and maybe I should go back here, if you're looking at different strains, and then particularly the True OG and Train Rec, if you're looking at that and saying, well, gosh, the numbers are the same, what's really the difference here? They're both hybrids, so indica sativa plants that have been blended. Train Rec's a little bit more on the sativa side than the True OG is, but really what is the difference between two plants that have similar amounts of active ingredients, right? And so what that really comes down to is the terpenes, the essential oils of the plant. And so what you're looking for are the essential oils that might be helpful for the condition that you're trying to treat. And so in this case with pain, you're looking for ones that help with inflammation. Remember, reducing the anxiety, stress is a key part of chronic pain. So the limonene is key, the pinene for inflammation, the myrcene also for that calming and anti-inflammatory effect, and the carfilene for reducing pain and decreasing stress. So those are really important ones to, you can look up the strains if your bud tender at the dispensary isn't able to share. but you'll want to know this is what makes one different from the other. Even when people are telling you what they like about one, I mean, it's smell and taste and what have you, but a lot of this has everything to do with that.
We know a good portion of this stuff. We took an interpreting class.
Oh, you did?
Oh yeah.
Very good.
Oh yeah.
And plus, you probably got it from the
MCC.
yeah.
Yeah, it was in the
Cool,
MCC
cool.
too, but
It
it was more in depth. The other one that we took.
Very good, very good. So I think this becomes key and probably is part of the longer conversations at our office. So with every time we have a patient come in, besides reviewing their information, doing their card, we do an education session. And so how should you administer it? And so if you're talking about chronic pain, you have pain every day, for the most part, all day long, you're gonna want something that covers that period of time. And so oral edibles are the best option for that. They might take a little bit to kick in, but they're gonna last for 4 to 6 hours. That's gonna cover your pain for quite some time. If you have acute pain, breakthrough pain during that time, then using a vaporizer that kicks in within a minute or so is a perfect option to be able to kind of mellow out some of that pain that kind of broke through. Topicals I'm always a big fan of as well because I've never heard a bad thing about them. No one ever said they taste bad, right? And you can put them in the area that's bothering you most. And there's the terpenes can be very effective for this and have an effect. So definitely one of my favorites. So I'm often telling people based on their condition, what should they be getting more of an edible, whether they should be vaping. The tinctures are kind of like in between there, okay? So there are people that come in, they want nothing to do with vaping, but they might start with a tincture, follow it up to kind of get things started because they work a little bit quicker than the oral products. And then they have that to get started using the edibles during the day if they choose to vape it for breakthrough, and that's that's just your choice or not if you choose to do that, then that can be used for that breakthrough pain. So obviously more CBD during the day so you can be alert and be active. Maybe doing the 1-to-1 if you have more pain and need that THC. I consider THC just icing on the cake. The CBD is going to be your base. The THC is the icing on the cake for more pain. And in the evening, if you have pain and sleep issues, the THC can be helpful as well.
And this is the last time I'll interrupt you on this
No,
one.
you're fine.
One thing that I did learn as far as this, because you were talking about the edibles, how long it takes for the onset of it. I just not long ago was type 2, and so I learned just through trial and error, if you get sugar-free, the onset is much faster. You move from a 40-minute window down to a 10 to 20-minute window.
Very good.
Because your body doesn't have to break down the sugars.
Sugar. Yeah, they're very good. And they have sugar-free.
They do.
Very good.
You're very welcome.
So my medical recommendations. So at the end of the day, start with CBD. That's kind of where I start with everyone. Whether you want the tinctures, the edibles, what have you, start with your CBD because that's going to be the base of addressing your pain. And then adding in THC where it fits in for you. So whether it's the edibles because they are longer acting, or the vape, I kind of work through patients depending on what they need. A lot of patients will start with a CBD tincture, find that right dose. Typically, the research trials are often at higher doses than we typically see on the shelves. So I kind of work through trying to make sure that don't be afraid to go a little bit higher. It's CBD, it's not going to hurt you. It's about finding the right dose for your pain. And then they might go to the dispensary and get a THC tincture. And then they can kind of titrate that in according if they're having more issues with their pain. Also at the end of the day, don't forget the other forms of therapy. Whether you have to balance yourself out, you have to deal with that other pathway when it comes to chronic pain. So whether you're working with someone on it, whether it's counseling or coaching, or whether you're doing yoga or meditation, figuring out another way to handle this from different pathways is the best way to handle your pain. So that's it for me.
DDP yoga, y'all, try it. I'm not kidding you. I started doing this, and then I started doing DDP yoga, which is chair yoga, because I have a bad back, and I have lost 40 pounds
Very good.
Nice.
in just a little over 2 months.